On the East Coast, they're doing this thing where actually you to get even hired out of school, you have to sign a 2-year contract a lot of times. And if you don't fulfill your 2 years, so first off, if you don't sign the contract, they're not going to hire you. You have to
Yeah.
sign it. If you don't fulfill your 2 years, you owe up to 15 to $30,000 to
Wow.
the hospital. No,
Yep.
it's no joke. That's something that they're trialing, they're employing. In
Which is the wrong way.
contrary,
That is, it's the
it's
wrong
crazy.
way to do this.
But I think it's funny or it's interesting. In contrary, on the West Coast, for example, in California, and I know this is happening in Washington because I've had friends go through this, they're doing something similar, but instead of making you pay back the 15 to 30K, they're signing you on with a 30K bonus. And then if you don't
Okay.
finish the 2 years, then you don't get any of the bonus.
Hello, ladies and gents. I'm Glenn, aka Nurse Dad, former Navy hospital corpsman and current ER nurse, and welcome to my channel. On this episode, I interview Nurse Nico. He's originally from North Carolina. He's an ICU nurse, but for the last couple of years, he's been moving up and down the West Coast as a travel nurse. And he was good enough to sit down with me and have a conversation about a wide range of topics, from male nurses, travel nursing, AI, his experiences with COVID, and much more. So without further ado, let's kick this peg.
So I'll introduce myself for all of the folks, that follow you and may not follow me, but my name is Nico. I'm nurse.nico on Instagram, TikTok, YouTube, stuff like that. I am an ICU nurse by trade, and also recently, within the last 2 years, I started doing travel nursing. I started in like Northern California, San Francisco, and then went up to Washington, Seattle, and then now I found paradise here in Southern California in San Diego. And then on the side, one of my passions, you were talking about some of your passions with filmmaking. My passion is kind of, connecting with people, photography, videography, some video making, some short films here and there. But just content creation and kind of trying to pursue that and see what can come of it, because I feel like the beauty of nursing is that you're working hard for 3 days. We work three 12-hour shifts, and so you're potentially exhausted, but you have 4 off days. And so
Yeah.
like what are you doing with your off days? Are you just using it to like sleep and not do anything, or are you using that time to connect with people and try to make the world a better place? So I found that niche a little bit in fitness and motivational stuff, but also like with content creation here and there.
I mean, 4 days off, you can blow all your money if you're not spending it right, if you're not filling up your time with hobbies and activities.
Yeah.
Um, I find we're on our feet, so it's a no-brainer. You need to stay fit. Yeah, you ever see those nurses that they've been doing it for 20, 25 years and they're limping? They got this like permanent limp. I'm starting to get it actually. I woke up with my foot killing me today.
What's the secret to not get that?
Wow. I just trying to just working out as much as you can, which like for me right now is maybe 4 days a week. At my with my situation having two young kids, any workout is a good workout. So
Crazy, man. That's crazy. Yeah, and we were talking about this earlier. I'm 29 years old and single. I was dating a girl, a couple years back, and it was getting serious, but we just weren't looking to settle down. But I feel like, nursing is so difficult. I can't even imagine having two kids and like, being married. So I appreciate your hard work, my
yeah,
friend.
you got time. I waited all the way till I was like 38, 39. So it's like
Okay.
10 years
10
from
years I
from when
got in me. Okay.
I will say though, the longer you wait, when I guess if you start early, you know that at some point they'll be out of the house. Not that you're rushing it, but you know that you got time. For me, I'm going to be in like my 60s, late 60s. Oh, shook my table. So I don't have as much time. So That's the only one drawback, and the energy isn't there like you would think it is. But the two best people in my life, and my wife, all three of them. So I'm very, very happy. But I'm also happy that I lived my life, and I have no regrets that I waited as long as I did. I waited because I was waiting to meet the right woman. So, and I did. I'm
That's
glad
one
I
of
did
the, I
not.
mean, yeah, my dad always taught me the same thing is like one of the most, if not the most important decision you can make is like who you choose to marry, who you choose to spend your life with. So
You're from North Carolina. What made you go into travel nursing? And then the second part is that of that question will be, it seems very intentional that you went to the West Coast and you stayed there. And I'd like to know what made you want to do that. But so you were an ICU nurse, what, for like maybe 2, 3 years, 4 years?
4 years, yeah, four
And you
years. Yeah,
started out in ICU?
yeah, I went straight into ICU. It
What
kind
made that
of,
happen? What, because
yeah.
that's a pretty big leap from nursing school and then becoming an ICU nurse.
So it's a great question, and so for those watching, I think West Coast nursing is very different than East Coast nursing, and it's a little bit more common, I think, on the East Coast to actually start in the ICU. But I think actually I've been talking to some friends recently, and the East Coast management, I think, is now transitioning a little bit more toward West Coast ideals where they're not hiring as many new grads into the ICU. But when I started actually nursing pre-COVID, it was in 2019. There was a lot of push to try to get new graduates in the ICU with the theory
Yeah,
that we're gonna train these new nurses. They're fresh out of school. They're very moldable. We can kind of train them to the standards that we want them. And I think it was a blessing and a curse because they throw these very young professionals. When I graduated, I was like 24 years old. I was like, I mean,
yeah,
I'm still not that mature, but I'm more mature now with having some life experience. But
for
when I
sure.
was 24, I didn't know what the hell was going on. And so they throw you into these like crazy situations, and then you just treat it as if that's normal. So you're getting doubled in the ICU or even tripled with these crazy assignments. Management is
Yeah.
just saying like, "Oh yeah, this is normal. Like just handle it, just grind, just work, work, work." And then now
And you don't know any better.
you don't
So
know any better. You don't know any better, and it's kind of this culture of let from a like a business perspective and a management perspective. Let's test the waters with like how much money we can save and how unsafe safe we can make the conditions and how much
yeah,
we can actually push these nurses to do without, causing catastrophic errors and mistakes and stuff like that. So I think the East Coast and specifically, I'll speak for North Carolina, they have it down to like the science of how difficult can we make it while also, creating a decent work culture to try to have this retention and stuff like that.
yeah.
So, but,
You,
but
you- yeah.
go ahead. Yeah.
No, 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 no. You just I wanted to save this toward the end, like as a question, and I was thinking about this as I was picking up my kid from school. I was thinking about the state of nursing, and it's almost like I read this article that this study conducted by the Yale School of Medicine. They reviewed the financials of 88 large healthcare companies and concluded that over 20 years, 95% of their net income went to shareholder payoffs. Now,
Wow.
I can't speak for, individual hospitals, but it was like I was thinking about the article and thinking about work, and it's a lot like how how much can we give, the provide for the healthcare staff and the patients and everything? How much equipment can we get them? It's like how little can they get by with
Yeah.
before a disaster occurs, and like the last hair, that's what we'll give them. Like if it's like almost like a staircase that ends and then you just drop. They're gonna put you on the last step. And you also were making me remember something I was thinking about, like what's normal versus what's reality. And I think a lot of people they forget that your reality doesn't necessarily mean this is normal. And I think I was talking to a nurse the other day. She was feeling like crap because she was falling behind, and she's got a crazy amount of patience and everything like that, and situations occurring. And I said to her, I'm like, this isn't normal. This is our reality, but don't beat yourself up
That's
because you
tough.
had
Yeah.
8 people and a STEMI came in while you're taking care of 2 sepsis patients, and then this drunk is acting up, and the nursing assistant is on a break. Like, this isn't normal. This is our reality. When I was in field medical training, there was we spent like 3 days just kind of going over the best ways to sever the arteries that we
Mm.
were the carotid or things like that in a situation like if we had to defend ourselves, like the best way is to sever, to stab. That's not normal. That's our reality.
Mm.
And so for her, it's like you're doing something that's not normal in a kind of a crazy reality, and you're handling it most of the time. But don't beat yourself up like you're like a
It,
bad nurse.
it's a
If you're
great
falling behind,
segue
you know what
because
I mean? It's
so
it's
so it I had never actually really thought about it like that. I think it's a very powerful perspective that, your reality and your normal are not the same,
and I try to remind people like don't beat yourself up in those moments. Like take a minute or you're rocking at 99.9% of the time, but there's moments where it gets a little tough. You sometimes it's like when you're busy at that last hour of the shift, you were great, and your handoff to the next nurse kind of sucks. And you're like, yeah, I'm sorry. I couldn't read the history of this person, or it took 25 minutes to get the IV and this, and they wouldn't do the ultrasound or this. It's like, you feel you feel like crap, like you're a crappy nurse because your handoff sucks. And it was, but that's not your fault. Sometimes stuff happens, and the baseline is that we're not working in a normal environment. That's our
Yeah,
reality, but it's
so the
not normal.
segue into travel nursing is that so I did 4 years of that, like we were talking about, and then I started just kind of questioning, and I had this like underlying, question of, is the grass greener on the other side?
Yeah.
Is what we're doing normal? And I think, going through COVID, and I worked through, 2020, that was absolute, catastrophe, and seeing these extremely sick patients come in. I remember like people
Yeah, I
ask
see you
me
got
all the
slammed like the ER got slammed.
slammed, like, and I remember someone asked me the other day is like, at what point did you like recognize or realize that like COVID was like ridiculously like sick and unsafe and all that? And I remember there was like an outbreak of COVID in one of the jails, like near our hospital, and we started having these like freaking buff, ripped, like 300 pound, like strong dudes like coming in like sick, like dead, like almost basically on death's door. And that's when I was like, wow, like this is taking out, the elderly, it's taking out 70-year-old Mima, and it's taking out these like fit, prison workers who are
Yeah,
absolutely grinding, like these fucking like football players. And that's when it like clicked for me. I was like, this is more than just like a flu. Like this is getting people like,
yeah.
dead, dead.
It didn't feel normal. I was in Queens at the time, so we were getting
Okay.
hit before everybody. And it was at that time where people were asking you, "What's it like?" And I'm like, where do I even begin?" I
Right.
would just say like it's like lighting something on fire that, oh, how do I explain it? It's like if you have an ailment,
Mm.
COVID's going to find it. If you've got
Yeah.
a asthma, COVID's going to COVID's going to throw your respiratory system out of whack. If you have any kind of neurological issue, I once treated one of the most shocking things. I once treated a woman who had COVID. This was in 2021, so it's like a year into it.
Well, that's
Probably
probably,
like
that was probably like the Delta. The Delta was horrible.
well, I forgot which wave it was, but that's when it was
Okay.
like the second or third when there was more stillborns and more babies were getting it.
Yeah. Very, very
Um,
sad cases. Yes.
Yeah, yeah. But I remember this woman. She was paralyzed from the waist down. She had to have like a diaper. And I said, "What happened to you?" And she said, "I became paralyzed after COVID." I just could. I mean,
Ow. Did she have like some type of like a clot that went to the brain and then she became paralyzed or
I didn't at the time. I didn't ask any details about it. She didn't seem like the type of person maybe comfortable with getting into it.
yeah.
She's still dealing with that, and she
Sure.
hadn't fully accepted it. So I kind of left it at that. But
Something that you
she
said
was
that really, I would say this all the time during those times too, is like COVID would do a really good job of exposing your underlying health conditions. And
yeah.
like, I think a lot of people, even now into 2025, you see people walking on the street, they have no idea, like pathologically, like what's going on in their body, like what's their A1C, what's their arterial function, their like, ejection fraction, all that stuff. And
Yep.
sometimes it takes like a strong, virus like that to like expose all of the problems that your body's facing. And so something that I'm trying to work on at 29, is trying to eat healthy, trying to stay fit, trying to basically because I see these patients coming in with all these ailments, and one of the biggest things that we see in modern America is a lot of that is attributed to, poor diet and sedentary lifestyle.
Yeah, I'm gonna be careful with this because this would be a 5.5 hour podcast on just diet. My kids got me. I mean, look, I was always watching what I was eating, but I got real serious about. Well, I started educating myself about, say, seed oil,
Seed oils,
or
yeah.
so basically, like I get my kids like real mayonnaise, real peanut butter, real jelly. Um, I try to find the cleanest stuff that I can, not just like because they sell you on the idea of like, oh, hey, look, this box of cereal is high on protein. And you're like, great, I'm getting that cereal, but
Right.
read the ingredients. Something I
Sure.
never really use. What's it called? It's like you look at something and say, oh, palm oil, sunflower oil. Well, that's you don't want see vegetable oil. Vegetable oil was a lubricant for engines in the 1800s, and then they
Right.
had to stop. Then when actual real motor oil and lubricant came out, the seed oil companies were like, "Well, what do we do with this stuff? Let's feed it to
Sure.
the Americans." And the Americans rejected it for a whole generation. It was like, I'm not gonna eat engine oil. So they waited about 20 years, and around 1900, they created this product called margarine, which is like butter
Yeah,
and seed oil.
that's
And then
right.
by the 1920s, seed oil is very popular. And what's interesting, there was like this study done like between 1927 and 1987.
Mm.
The amount of sugar an American ate didn't really change a lot, but the obesity rate skyrocketed. And so they're like, well, if it's not the sugar, what is it? Well, what do you
Right.
know? The seed oils. There,
Fascinating.
and even if you watch what you're eating, if you're someone who loves to go to restaurants, guess what they cook that stuff in? So the
Seed
food,
oil. Yeah. Well, but
So I'm just more conscious of
it,
that.
and I think this is something that we're starting to gain a little bit more knowledge, and with the internet, people have a lot
Yeah,
more knowledge at their fingertips now, and people are starting to pay a lot more attention to this. But the FDA and the food system and the pharmaceutical industry is all interconnected. And I
yeah.
hate to say it, and this is just the truth, a lot of times those corporations don't have the American public's best interest in mind. And so now we're starting
Like the
to,
food pyramid that we used for
yeah,
so many years.
the food pyramid is
Complete
no
crap.
joke. My mom is actually like she's a registered dietitian, and she has done a lot of work with like public health and getting into a lot of the research pieces. And she believes it's a big scam, and it's something that I think the American people now are starting to kind of
Yeah,
question a lot of it. And that's I think we're at the very early stages, but I think the best way to solve a problem is to first ask these tough questions and try to
yeah,
get details and understand it.
yeah. The fact that like there could be that bread could be baked in a carcinogen,
Mm.
or that there could be these kind of chemicals in the food in the first place. And I think we were talking about COVID. COVID put a bad taste in people's mouth in terms of bureaucracy.
Sure.
And I think this skepticism has transferred over to pretty much most institutions, and rightfully so. I feel with because of the lack of transparency.
So let me ask you this question. I think this is a good question. It's something I think about too, with especially getting into kind of like the conversation of like the AI and the tech and stuff like that. What do you see as like the future of nursing? Like, what do you see as the role of the nurse?
Yeah.
You can even dabble into ask. I want to talk to you about like being a male nurse, how that has impacted you.
Yeah,
What are some
we're definitely going to
benefits?
talk about males in nursing, definitely.
Yeah, for sure. But yeah, so okay, we'll keep it umbrella. What do you see as the future of nursing and the nurse's role in modern America and into the world rather?
Well, I'll lead with a study that was done by it was led by a doctor, and they so medical a misdiagnosis is like the third leading cause of death in the United States, right?
Wow.
Which is kind of crazy, right?
Yes, it is.
Medical errors
Wow.
and or third or fourth. It's either
Yeah.
third or fourth.
Yeah.
But so this study was done where they so a human physician is has a 72% accuracy is 72% accurate when it comes to medical diagnosis.
Hmm.
And the study was they used AI, and it turned out that the AI, the computer, was over 90% accurate. I think it was like
Wow.
92. And then they did it, and in the study, they had, so the AI was over 90% and the human was 72%. But then they did it where the doctor and AI will work together. And I'm thinking to myself, okay, the doctor and the AI will work together. Um, what's this going to be? And it went from 72% to 74%. And I,
Dang.
you know, and I'll get into the nursing aspect, but I couldn't believe it. And think about like the average patient, especially as they get older or they have, tragically they have cancer or this or that. How many specialists do they go to? Or or sometimes for like a year, right? To even get a
Yeah.
diagnosis. And if it happened to you, if it was like your spouse or your relative and they're going through it and they're trying to find out what is happening to them. If somebody said, the computer is about 92% effective, I think most people would be like, let the computer diagnose me. I think that's how it kind of starts.
Yeah.
Um, and then what happens to
Especially,
doctors?
I think something that is kind of this like forbidden fruit is like the insurance companies limiting, what testing can get done.
Yeah,
You have to get a referral from a specialist. But I think something that you hear a lot of literature and a lot of reading is like abroad. For example, I use Turkey. I was reading a study in Turkey the other day where you can actually go into these like clinics, you can get yourself a full CT scan, MRI, X-ray, EEG, brain work, all this data for a fair price. I think that it was saying that's like between $3,000 to $5,000, which in the US that's unheard of. But you're left with all this data. Again, there's no physician involvement at all. And then the kicker is that at that point, once you have all the data, they run it through like an AI
oh
algorithm
wow,
that tells you kind of, what's the state of your heart? What's the, is there anything super emergent or alarming? And then at
yeah,
that point, if there is, then you can take that data and that, algorithm and then take it to the hospital or then take it to a specialist at that point and say, hey, I just did this study. Like, this is what it's showing. What's the treatment? Or where do I go from here? But it's almost putting the power into the consumer. And if I had to take a bold assumption or a guess, that's what I think the future of medicine is. That I think there's gonna be this separation between like, research data, AI, prevention, and then the hospital, the treatment. I don't think nurses are ever going anywhere because I don't think you can really truly have an AI
yeah.
robot that can, accurately put an IV in or put in arterial line or intubate someone or all of this hands-on stuff. I don't think we're there even close. So I think the
But
role
that's not
of
even so much of what is done. I mean, half the time it's like, you're getting shouted out. shout it out for this thing, or they need this
Yeah,
task. Is it,
right.
it's stuff that a robot or whatever is just not going to be able to
Cannot do
do,
it. Yeah, cannot do
change
it.
somebody, or how is it, it's,
Funny, I saw like it was almost like a meme, but it was kind of accurate, and it was like in the year, 2100, we're in the nurses are gonna have their own robots that can delegate, like, hey Chip, can you go turn that patient for me? And then the robot like
yeah.
walks away and like turns the patient for you.
It's going to be interesting with the future you painted based on Turkey. What I remember, I did deployment with the Marines, but we were on a ship for part of it, and a lot of the naval ships with medical crews will do goodwill missions. So if we were in the South Pacific and they helicoptered some guy from one of the islands for some kind of heart surgery on the
Mm,
ship, and but obviously because this island nation or whatnot, they don't have, esteemed cardiologists, right, and surgeons, but it'll be interesting
wow.
to see these countries that are, you know, developing countries have AI. Like
Yeah.
they didn't have any specialists that could diagnose anybody, but now you have this computer system that can do
Wow.
it. And
Yeah.
and at some point, you're probably going to have, I would imagine, like some kind of room with the arms and things like that that actually might be able to also perform certain complex surgeries. Yeah,
Yeah.
who knows? So
The robotics piece and all that.
yeah,
Yeah.
I mean, you were talking about like 100 years, 50 years. So I that'll be interesting to see what happens to those countries. Like there might be a more even playing field with access
Yeah.
um, with that.
Is that a good thing or a bad thing?
I think it depends on how it's employed. It's if you make it so you have to spend a whole bunch of money or you have to have so many things in place in order to get it. That's an interesting question. I guess if you don't have anybody now and you can't help or diagnose certain things, then it's a great thing. If we become a society where AI takes over a lot of human jobs, what are people going to do for work? What are what's going to happen to purpose? I think a lot of the issues we have as a country now is that people don't have as much purpose. Um,
Powerful. I agree. I
I,
agree
I, I
100%.
think there's a lot of issues with self-worth.
Definitely have a purpose issue. We have a anxiety, depression issue. And I think there's a lot there's not one, root cause. It's just this accumulation of modern society, technology, artificial intelligence that's leading to a lot of this illness. And the question is, how do we solve it? Or how do we nip this in the bud? And I think there could be more resources spent on, mental health, psychological help, psychiatry. But ultimately, I think it's got to start in the home. And you're a dad yourself. I think that's one of the biggest things is having, a support system, having two parents in the home, to me has been very, very valuable. And I think that's something that, if I had to say one of the biggest issues in society now is, the divorce rates are up
Yeah.
catastrophically. You have, substance abuse is up catastrophically.
Depression.
Absolutely, absolutely.
I think it's the small things. Because you're in California, so I've been thinking about that. But when I was in Camp Pendleton, and I was a total New York City guy,
Hmm.
and I suddenly find myself hearing coyotes during a field op when I'm trying to sleep, or I'm outside doing these huge range movements in these
Right.
mountains and grass, but I found myself really at peace
Oh,
to
wow.
just unplug and be out there. And
Wow.
even if the work was rigorous, I felt like I was more grounded.
Hmm.
And yeah, the work I was doing, I felt was worth it. But to just be outside like that, you don't realize like in New York City, you know you're just another spoke in the wheel in terms of like everybody that's there and urine smelling
Got it.
subway cars and griminess and loud noise and just you just always you look up at all the buildings and you're like, oh, I wish I could live up there. It's like a lot. You spend a lot of time thinking like that. Oh, I wish I could go there. Oh, I wish I could drive that. Oh, I wish I had. And then you get out there in the field and you're hanging out. You're trying to get out of the shadow at 9 in the morning because California's freezing in the morning. Even though it's going to be hot later, you find yourself like standing in the sun to warm up. Like you're using you're employing these basic tactics. You're drinking water because you're thirsty, and you're standing in the sun because you're cold, and you're trying to like find a good spot in the dirt with your foam mat, iso mat we call them, to sleep on. I was working out with rocks in the field. I would find these rocks and I would do like a workout and stuff like that. But I never slept better and I never felt better.
Wow.
I wanted to ask you, so yeah, it seems very intentional that when you became a travel nurse, you it sounds more like curiosity. You wanted to see what more was out there, right?
Yeah.
Um, and you went to the West Coast. What made you go to the West Coast and stay there?
Yeah, so I think one of the most, I think, impactful moments or experiences for me to become a travel nurse was actually that I met a group of 2 to 3 travel nurses who came to float to my unit in North Carolina. And they absolutely like changed my perspective on like what nursing could be, or what options you have as a nurse. What first off, you hear this term as a new graduate, or if you have a couple years of experience in the hospital, you hear this new term like, oh, travel nursing. It would be so cool to be a travel nurse. What the heck even is a travel nurse? What do they
Yeah.
do? So to have these conversations with people who actually had done travel nursing in California, in New York, Florida, Oregon, and then now they're in North Carolina and they're sharing their experience. These people necessarily didn't know each other, right? But they all had said the same thing. If you're going to be a travel nurse, I would highly, highly recommend to start in California. Every single one of them said that.
I mean,
They're
I know the contracts are pretty lucrative out there.
Yeah, so their evidence to support that statement is that the pay
There's a
is
lot of people. It's like they have a lot of need.
the, the pay is going to be probably some of the most competitive, the highest pay. The unions and the way that they support travel nurses and the staffing is going to be second to none. The paid breaks are going to be, nothing like you've ever seen before on the East Coast. You actually have dedicated break nurses that will actually, come in, take your patients for 30 minutes in the morning, 30 minutes at noon, and then 30 minutes in the evening. You don't have to
I'm
worry about
experiencing that now,
anything.
by the way. I'm
It's,
experiencing that now at my house, and it's a luxury. It's
yeah,
a
that's what
luxury. Here, it's a luxury.
we were talking about this earlier, is that a lot of East Coast nursing is now trying to adopt West Coast nursing because I think we're seeing this issue with nurse shortages is a big problem. Nurse retention is a big problem. And so what's happening on the East Coast is you have a lot of people who are working 1, 2, 3 years, and then they're like, I want to go to the West Coast where I get paid more, I get supported more, I get my breaks. And so the East Coast, administrators are saying, okay, how can we bring some of these ideals and get
Mhm.
people to retain over here? Um, but yeah,
To your point, I think there's a lot of like probation. There's a longer probationary period now where
yes,
they hire you here, and people might be surprised to hear this. I've worked at some of these hospitals. They hire you as a new nurse.
yep,
Um, and then you do some kind of residency where they
yep,
put you in different departments, which is fine. But there's also a catch. If you were to start working and quit, you
mhm.
may owe money. It's like,
Oh
which
yeah,
is like
it's
kind of the
no
wrong way to
joke.
go about
Yep.
it, you know? It's like, You
So
know.
it's funny. So I can speak to that 100% because I had a couple friends actually do that. So on the East Coast, they're doing this thing where actually you to get even hired out of school, you have to sign a 2-year contract a lot of times. And if you don't fulfill your 2 years, so first off, if you don't sign the contract, they're not going to hire you. You have to
Yeah.
sign it. If you don't fulfill your 2 years, you owe up to fifteen to $30,000 to
Wow.
the hospital. No,
Yep.
it's no joke. That's something that they're trialing, they're employing. In
Which is the wrong
contrary,
way. That is, it's the
it's
wrong
crazy.
way to do
It
this.
so, but I think it's funny or it's interesting. In contrary, on the West Coast, for example, in California, and I know this is happening in Washington because I've had friends go through this. They're doing something similar, but instead of making you pay back the 15 to 30K, they're signing you on with a 30K bonus. And then if you don't
Okay.
finish the 2 years, then you don't get any of the bonus. So you don't have to pay back money, you just don't get the bonus. And I think a lot
Right.
of people are like, that sounds very,
You want
very
that bonus?
that's a new car. That's a new,
Oh
whatever.
yeah.
And so in order to get that bonus, you don't see a penny until you hit your 2 year mark and then bam, you cash it. You could leave the next day if you wanted
Yeah.
to. But hey, but then now that hospital has a reliable employee for 2 years. You might even like the hospital system. You might even want to stay longer. So I've thought about doing something like that. If I ever were to transition from travel nursing back to like a staff position,
Yeah.
I would go somewhere that offered a sign-on bonus, like a 30K, 20K sign-on bonus because they're out there for sure.
They're not here. Not where I am.
Not here. No.
No, the appeal though to going back to staff is that if I do want to go to school, I
Mhm.
want the tuition assistance. If I do become an MP at some point, I definitely don't want to pay out of pocket for that.
Which, by the
Um,
way, it's a quick segue, but I think I have known you through social media. Actually, I mean, me and you have connected more recently, but I think you would
yeah,
be a phenomenal nurse practitioner. I watch your content that
you
you post,
yourself, you
and
yourself.
well, maybe, but I think I'm more, at least my brain, my more mindset is a little bit more like individualistic, and I think that's more suited for like a CRNA. I just want to,
Yeah,
focus
yeah, yeah.
on one patient and like provide this anesthesia. You have a very like, I think business mindset, but also like you're a very father figure. I think you're a good leader.
Oh,
You
thank
have,
you.
this very quality, personality. And so I think that's perfect for a nurse practitioner. Like I would trust you to be my nurse practitioner, but I would also want you to be the nurse practitioner who's caring for the patients when I'm a staff nurse because I would feel confident to go to you with concerns knowing that you would be able to address it.
I appreciate that. I have to ask you, this East Coast nurse that I am has to ask you, how are the ratios out there? Because I, funny story, I was a few times I've worked in the emergency department with a travel nurse, could be from like Columbus, Ohio, or whatnot. And they've said to me, I heard about the ratios in New York, but I didn't believe it. I cannot believe I have like 14 people right now or 30, and they're shocked and they're like, just so you know, I think one woman was like, just so you know, it's only you guys. You're the only
Okay,
people doing
so
this. So,
So something that people may not know about California and Washington, Oregon is these are all union nursing states.
mhm,
And so that's two things. So when you're talking about ratios, I'll speak for California because that's where I'm working right now.
yeah,
So California as a state has passed legislation that mandates what a safe nursing ratio can be. So in the state of California,
I think that's the only state that's done that, right?
I'm not
I, I, I
sure,
think so.
but it may be in Washington as well, but California does it a little differently, and I'll explain that. So in California, there's state mandated ratios. So for example, in intensive care ICU, which is like, the highest acuity, let's say, the maximum amount of patients you can have is two. In other states, you can have
Ah,
up to three patients in ICU. California, it's two, and then you work down. You have like your PCU or your DOU. The max you can have is three. You can never get more than that in DOU PCU. Then you have like your
You talk about
telemetry.
ICU,
Then you have your
ICU,
sorry,
or
go ahead.
these three patients is the most in ICU. Is that what you
Two in ICU
two?
two. Yeah,
Okay.
in intensive care, you will not be caught dead having three patients. Telemetry, if you're a telemetry nurse, the max you can have is four. Med surge, the max you can have is five. So it's this clinical ladder
Wow.
of, two, three, four, five. The max period that you will ever have in the hospital system in California, five patients if you're a med surge nurse. Now, that being said, that's statewide as an
Yeah.
entity. That is different than what you're having. It's called like union ratios. So unions now are stepping in and saying, hey, our nurses don't want four patients in tele, they want three patients in tele. So you have this push that the union is now trying to say, hey, we want, these tele nurses to only have three. We want these med surge patients or nurses to only have four. We want ICU patients to only have one. Like if they have a certain device or like a
Yeah. Yeah.
dialysis or an ECMO or something like that, the state says you can have two. The unions say no, they can have one. And so now we're in this it's like a little fight
Yeah.
between state and union, and they're still kind of wrestling out a little bit of the drama, but it's funny. You'll like in the hospital when you walk in and you'll hear the charge nurses giving report. They so often they're bickering between like what's the state say and what's the union say, and they're in these little
That's a whole
conflicts.
different. Yeah, I would
It's
never
a
think
it's
thought
a
of that.
it's
That's
a
a
whole
whole different
different
world.
thing.
What does
I
that do though to to like the patient wait times or the ability of a patient to be seen like a so if the law is say five in med surge and you have an influx of patients, what happens to them? They if by law they can't get more than five and they have it's a a busy it's just getting busy for whatever reason. What happens? Like what do they do? I would imagine that, like every other system out there, these companies still don't want to hire what they need to meet the
Yeah.
demands. It's always going to be the middleman who suffers. It sounds like it's not so much the nurses, but I would imagine now it's got to be the patients.
Yeah. So I think in sales or in business, there's this like pyramid where it's like, is it cheap? Is it fast? Is it safe? You can
Yeah.
never have a perfect triangle because one piece is going to get, missed. And so when it comes to nursing, I think it's going to be safe in California. It's going to be cheap. It may not be fast. And so in the ER, you're seeing these crazy waiting times. Like I remember I was looking at the waiting time the other day. Some patients are waiting up to 12 hours in the lobby. 7 to 12 hours is a very common wait time in the ER, and that's crazy.
You talk about just the waiting room.
Just the waiting room.
You told me what made you become a travel nurse. I remember the moment I wanted to become a travel nurse. I was working and I had a shift where I think I might have had like 11 patients. I think I had three patients on a one-to-one, but there aren't enough nurse assistants, so
Yep.
it was like a one-to-one and a two-to-one,
Wow.
which it's not safe. A two-to-one, I
Oh,
don't think legally is going to hold up in court. If something happens to one patient while you're looking at the other,
exactly.
I think you're going to go down with that ship, even though it's not your fault. But I had an ICU patient, and she was decompensating, and the ICU it's like how long can we wait before we have to take the patient? It's like,
Yeah.
but so the doctor came down and he wanted an update, and I said to him, I was getting so tired because it was like she needed to go up for hours, and now she was really decompensating. And, you know, not to sound, I mean, I care for the people, but also I if this goes south and there's legal involved or whatnot, I'm a part of the medical team. Like,
Yeah.
even though I have no power to get this patient to the ICU, I'm going to go down if something happens to her,
Oh
because
yeah.
I'm part of I'm the name of the caretakers, you know. So I also get worried about my livelihood
Hmm.
in these dangerous situations. So, but I told the doctor, I said right to his face, I said, he asked for the status. I said, if you don't take the patient up in an hour, 2 hours, he's going to die, and I'm going to throw you under the bus in my charting. He took her up in 15 minutes.
Right.
I had to actually get to that level.
That's
Um,
crazy.
but but I remember I was like, I'm done with this. Like I got to a point where COVID kind of exhausted me. 2 years of that. Um, the ratios at this particular place, though I love the staff, and I actually to this day my favorite staff I ever worked with. I just couldn't take it. I was getting so tired, and I felt like nursing was. I was not happy to be a nurse anymore. I needed a recharge, and I was getting bitter. And I'm not a bitter person, so to feel this way was just not jiving right with me. And I needed for like a couple of years to just be able to go to a place, and if I like it, maybe I can renew a contract. If I don't like it, I'm out. Or
Were
it's
you single
kind of
were you
liberating.
single at the time?
Huh?
Were you single at the time?
No, I was married.
Okay,
Well,
you're
so I'm
married now.
okay. So I'm like the married version of what you're doing. So I do travel nursing, but within a radius of my house.
I gotcha.
So
Yeah, yeah.
so not more than like an hour, hour and 15 minutes.
Incredible. Yeah.
But I have a thing now where I can work at any hospital within this particular healthcare system, and they're huge.
That's sweet.
So I could, yeah. So I've worked at like six
Do
or
you
seven of
do
their
you get the
hospitals.
like the travel nursing stipend, or since you're like a local, do you just get like a higher hourly?
Yeah, I get the higher hourly,
Yeah.
and I'm on my wife's insurance, which I
Perfect.
think for people watching, it isn't the cheapest thing when you do have to pay for your own. I would imagine you're paying for your own insurance. It's
So,
a little pricey.
oh gosh, it's crazy. It's $600 a month.
Yeah, it's expensive.
Yeah.
My You were talking about unions at that hospital in particular. I love the union there because the union dues were $120 a month, and it covered full medical for me and my family. And I don't
Incredible.
recall ever paying a copay.
Incredible. Yeah.
It was incredible. That was
Yeah.
the best. We doubled up because if I could double up, I would. Just feel like feel extra protected. But yeah, it's too pricey to to do what I'm doing now if I had to get medical coverage for me and my family. It would be like probably 1,500 a month. It would be obscene.
Wow. What does your wife do?
She's in business,
Okay. Yeah.
so she works a lot remotely. I mean, she goes to an office in the city, periodically, but she is a businesswoman. And I'm very glad. I don't think I could be married to a nurse and come home and like we're talking about our shifts. I can't do that. The
I
last thing.
think the more I think about it, I could not agree with you more. Ironically, I think I've only dated nurses like the past like 3 years, and I think I'm just like over it. I think it's just too much, nursing. It's too much like the
Yeah,
stress, like all yeah, on your off days, it's like, you're eating sushi and then you're talking about, man, my patient decompensated and needed 39 blood products the other day. And then it's like this back and forth and it
yeah,
takes you back. It's like you're regressing back into, the hospital and the nursing when the conversation should be about,
yeah,
honey, let's go on this beautiful hike. It's a beautiful day. Let's go watch the sunset. Let's go do
yeah,
this. You're regressing into almost like your previous shifts. And I
yeah.
hit
I can't
the
do
point where
that.
I was just like, I can't do that anymore. I met a couple, nurses out here that I've had attraction with and gone on a couple of dates, and it's just been the same thing over and over. And I'm like, I want to meet a girl like in real estate. I want to meet a girl in marketing. I want
Yeah,
someone who's going to challenge me in other avenues. So
yeah.
if
There's
you
not. I mean, nothing
if
against
anyone
nurses,
knows
but it's just
anyone out there in California who like an engineer, someone completely not in nursing, let me know.
well, you were speaking to when we first signed on about the off days and hobbies. You got four. You're I think it's also important too. People don't realize like you're taking care of people at their worst. It's not like you work 3 days a week. You're putting in the work, you're working the hours. It's just that they're just 3 days. But you're like I remember yesterday I couldn't even have my cup of coffee for the day till 6 p.m. It was
Wow.
just a crazy day.
Yeah.
And I was like one step behind. I got four patients in a row that nobody could put an IV line in, and I'm good at what I do. And it was like, it's just like aggravating, They needed an ultrasound guided, and you know, yeah, it was just a crazy shift, and I'm still tired from it.
It's funny because it doesn't happen often. Most times when I tell people I'm a nurse, like if I'm in street clothes or whatever, they're like, "Thank you so much." Like I know nurses, like I know how hard you guys work, and they thank me for my service. Every once in a while, you'll get someone that's like, "Oh, yeah, you only work 3 days a week. Like, your job must be so cush and this, that, and the other." I'm like, I wish you could
Yeah,
go into work for me for, even 4 hours and you would be destroyed. You would be
you got to watch that show,
absolutely
The Pit,
destroyed.
man. I've been making my wife watch The Pit on
Brother,
HBO
it's a great
Max.
show, isn't it? It's
Yo,
crazy.
that show's good.
It, it's so good, and it's actually funny because I'm making to kind of go back into the content piece. I'm making a video right now on Instagram where like people have been asking me like when sometimes I'll like be vlogging as I'm walking into the hospital. They're like, what do you do as an ICU nurse for like 12 hours? Like what does your day consist of? And the similarity between the pit and the video that I'm making is the pit is like it's been 10 hours of show and
Yeah,
it has almost felt like it's been like months. Like the treatment that
yeah,
they're putting on these patients is so
yeah.
ridiculous. And the
Yeah, I love
funny
that one episode is 1 hour. It's like
one
all that
episode
stuff
is
that happened. That's
is
one
one
hour.
hour. 1 hour. Yep. And
What?
they're seeing up to probably, 10, 15, 20 patients every single hour. You're seeing, a car accident, a drug overdose. This patient just died. They're coding this patient. This patient just got brought in from a gunshot wound. This patient just drowned. And it's like, wow, that feels like it was like 6 hours. No, that was 30
Yeah,
minutes. Like
yeah.
that
There
was
was an
30 minutes
episode
every
where the
day.
the pediatric patient, the little girl died saving her sister. She dove in
Oh,
the pool, and the sister got out, and she drowned. And my wife's like crying and all this, and I'm like,
so
remember
sad.
that? Remember that story? That story I told you. I had a brother who's like 14. He couldn't swim, and he dove in the ocean to save his brother, and he drowned, and he's on my table, and it's like I'm like, because sometimes I come home, I'm a little tired. Maybe I look like I'm not in a good mood.
Yeah.
You know, just kind of like maybe sometimes maybe I just need to take a minute, or like, let me have
That
a minute,
episode
like
of The
watch
Pit,
that show.
that moment, I almost like literally shed a tear. Like I'm not that emotional, but when I
Well, I
remember
did because it,
it
it
was the
reminds me of my little
girl,
girl. That's what gets you.
the little girl that saved her sister, and then she was like drawing and she was like,
Yeah,
I want to make this for my sissy when she gets better. And then it cuts to the scene where it's like the doctor and he's like, unfortunately, she's not going to get better. You have a 0% chance of making it when your,
yeah,
potassium's like over 10. And that's when I was like, oh my God, it's so ridiculous. So my point was this. When I posted that, so many people were reaching out. They're like, "Oh my gosh, you had drowning victims? Like that's so crazy, that's so sad." And then to hear you just share about your experience with that, that's a real phenomenon. Like this is stuff
yeah.
that we see on a daily, but definitely like a weekly, monthly
Certainly
basis.
a weekly basis. Yeah, definitely. If
Absolutely
not, if at least 2 weeks weekly, like a sad story like that. Yeah,
crazy.
yeah. I mean, we can go into stories. It's kind of, but and some are more nutty than others, and some are more tragic than others. I remember my one of my kid was born, and then I had my first like expired newborn come in. And the way they had framed it in the announcement, that they're so and so's coming, it sounded like it was like premature, a
Mm,
premature birth. And it
yeah.
turned out it was a full-term baby that the 14-year-old girl had in the shower, got freaked out, uh, left the kid on the floor of the shower with the water still running. By the time the EMS got there, they had already had to start, like, the kid was already having a heart attack. Um,
Resuscitation and all that. Yeah.
they're doing all, yeah, right on the spot. So when I see this, I'm thinking, oh, premature, it's tragic. But there's something about, like, if it's 20 weeks or 22 weeks, it's like, life can be really unfair. But when you see a full-term kid like that, and it was just a matter of, like, just circumstance like that.
How do you deal with
Yeah.
that trauma? Like, what are some ways that you cope after seeing a experience like that?
To continue that story, it was kind of, the child comes in, and some of the nurses were freaked out, and so I went right into taking over compressions, because people were a little bit, even the nurses were a little shocked. And the baby, she had these beautiful eyelashes, and it was a beautiful child, but it was kind of freaky to see a baby with, um, like, no baby smell, cold, the
Wow.
skin. It almost seemed like a realistic doll. And
Blue,
then on top of
probably.
that, the I never that one of the people of the cleaning crew actually started getting into a fight with the doctor, because then after they called it, the doctor wanted to do a sort of, because there was no family I'm not that it meant anything, but he wanted to kind of do a training thing, because you
Yeah.
don't get patients like that often. And the housekeeper took great offense to that. And then there was also the situation with, like, concept of ambulances, where not too far away was a hospital with where their ER, they had a pediatric specialty. Like, they were known for having outstanding pediatric care. And so a lot of people were like, well, why would you take her here? And it's like, well, this was the closest hospital. Even if
Yeah.
not too far away was there was a crew there, and a system in place to really care for this
Yeah.
patient, perhaps a better outcome. Even though I think the outcome that ultimately transpired was inevitable because of the condition. And then on top of that, so the mom comes in with the daughter, and then because of the what the mom had said and what the daughter kind of wasn't saying, there was suspicion that it could be incest. And that might have been part of why this girl was trying to keep it all a secret.
Mhm.
And I don't know what happened with that story, because I had become a travel nurse, and left ultimately. And then
Yeah.
the grandparents came in, and the charge nurse, I guess, got a talking to, because the grandmom took the baby, and while the grandfather was parking, she left the room with the baby and started introducing to all the patients her lovely, wonderful granddaughter, as if this was a live baby. So all these things are happening, and you're just watching, you're experiencing it. The code didn't go well. You're like, the grandma is introducing this dead child as if it's alive to patients. We got to, like, deal with this now. Uh,
Wow.
is this a product of incest? I mean, so many things are happening at the same time. And then it's like, well, I also got 10 more patients I got to attend to. The guy who's intoxicated screaming at the assistant. This person is yelling because the CAT scan's taking too long. I got somebody with a brain bleed. I got a chest pain. I got two abdominal pains. This person's getting COVID and they need it's just like, you
It's a
also have
perfect
to do your
example of,
job.
like, you can't make that up. It's like you
No.
have this circumstance going completely catastrophically wrong. You got to, as a nurse, you got to turn that off. And then now it's like you open the next door, you walk in with a smile. Hey, what can we do for you? We got to get blood cultures. We got to get an IV in. You got to put that
Yeah.
in the rear view. And now you got to treat this patient from the best of your ability as well.
Yeah.
It's crazy.
Someone yelling at me because like there's I've been asking for dinner for an hour and it didn't. I mean, it's just like
Right.
I
And what
wasn't
you
here
want to
because
tell
I
them
was in a
is
code with a
you want to
newborn.
tell them,
Like
sir,
it's
yeah, shut up. I was just coding a newborn baby that was blue, that wasn't breathing, stillborn. You can wait, but guess what? You can't say that, you know?
no, you can't say that, and they tear you apart with the surveys. I always joke that you can do any, you could save a patient's life, but if you're late with dinner, they're going to trash you on the hospital surveys.
At eight H
I
caps, no joke.
I said no ice. You're giving me ice. What's going on?
Exactly.
Uh, what has nursing been like for you as a male?
So I will say two things. So the first thing is I'm thinking about when I was training as a new nurse. I actually had one female preceptor and one male preceptor. And I think that experience was priceless to get the contrast because I saw some of the things that this like loving, nurturing mom like figure female nurse was showing. And I think I adapted a little bit of that like caring personality, and then
Yeah,
I would flip and I would be with my bro preceptor, and he was like, all about it. He was a strong guy, no funny business. Like, we're gonna get stuff done. We're going to, save lives. We're gonna do it caringly, but we're also going to not take any BS. And
yeah,
so
not take any BS.
being able to mold like both of those trainings and those experiences into like my practice, I think was, inevitably extremely valuable. I think the way that I would summarize it is being a male nurse, you have to know your strengths and you have to know your
Yeah,
weaknesses. And to me, when I'm thinking about like the charge nurse as an example, I think one of the most valuable qualities as a charge nurse is creating the nursing assignment. And so, what I mean by that is, as a charge nurse, knowing your staff and knowing which personality, which nurse is going to be the best nurse for like X, Y, and Z patient. And I think sometimes it is better to give a nurse a male patient, and then vice versa. Sometimes it's definitely better to give a nurse a female patient. And so I think again, knowing some of your strengths and your weaknesses is very, very valuable, especially as a male nurse.
I certainly try to be as nurturing as I can. I mean, one thing I like about being an ER nurse is you're kind of more Mr. Fix It. Well, at least I feel that way. I'm
Yep.
more. I feel like my strength is Mr. Fix It rather than the nurturing side. But the female nurses go through it a lot, a lot. I mean, even in the step down ICU, I would take report, and they could have had a real rude guy. Um, Throughout the night, and they're giving me report, and they feel like they were just like abused the whole evening. And I'll get in. I remember one time I got into the room, and the guy was kind of continuing that stuff, and I turned around and I said to him, "I'm not your wife."
Mm.
I mean, just to because you know what? It's like this isn't going to happen for 12 hours with me, buddy. It shouldn't have happened with her. Um, this ain't happening with me. I'm here to take care. I'll tell people right up front. This is a collaborative experience. You
Yep.
know, unless you're altered mental status or Alzheimer's or some reason that perhaps for you to act a certain way, if you're in control of your faculties, I'm not putting up with it. I mean, that's just how I am as a nurse. I don't threaten people, but I also let them know, you need me. I need you to. We need. This is a collaborative thing. I'm not going to be in here all the time if I'm going to be treated this way. Yeah, yeah, I'll do what I have to do, but I'm not.
And
I'm
I
not
think
going to.
one of the benefits of being a male nurse, or like something that brings me pride and joy, is like being there for your coworkers, like being ride or die for your
Yes.
coworkers.
Yeah.
And like, hey, if we got to clean up a messy situation, if
Yeah.
you got, blood everywhere, you got like stool everywhere, like we are there to get stuff done. We're there to take care of it. And contrary, hey, if we got a combative patient, you need a
Yes.
little bit of testosterone in that room. I mean, I'm not the most, strong guy, but like I can be a presence when need be. And I think that's why I
Yeah.
would love to have you on our unit because like if anything is going down, I would be like, Glenn, we need to take care of the
I'm the old
situation.
man. You're the young gun over there.
That's
I'm
right.
brittle.
That's right. Yeah.
Well, I've had like a female physician with a very uncomfortable. She was very uncomfortable with a patient. She asked me to come into the room with her. Um, some patients, I try to imagine myself as like a female nurse approaching this person, and I'm like, I would be intimidated. Like this is some. I was doing. I remember one guy. I wanted to do a finger stick, and he tells me. Um, if you hurt me and I'm a black belt karate, I'll kick you right in the head. And I'm like thinking to myself, I was like, whatever. But I'm like, if I'm a certain females that are trying to do this, it's like, what do you,
Crazy.
it's like, come on. I've noticed when I was in nursing school, there weren't a lot of male students. There were a couple of guys like me who were, this was like a second career. I think most guys when they're in high school, they don't think about becoming nurses. It's kind of not in our culture to think that way. I think a lot of men, they go into the world and they gain experience and they see the value of becoming a nurse later. What would you tell a young man who's thinking about becoming a nurse?
Yeah, it's a great question. I think so. Nursing does have a lot of, valuable assets to it. We were talking about the benefit of the schedule, only working 3 days a week. You get to help people, you get to care people. You said it perfectly, is like we're, meeting people in some of the worst days of their life. And so to be able to like flip that and give them, you know, healthcare, give them, that positive reinforcement that we're there to take care of them. We're there that you can trust us because we have seen this a time and time again, and we're going to help you out. But I also would say don't go into nursing if your heart is not in it because it is a very, very difficult profession, and you have to have a sense of compassion. You have to have a sense of wanting to, help people and be there for people. You have to, love communication, teamwork, all of these assets that, make, healthcare this holistic thing. If you don't have that and you're, asocial or you're more into like the computer or whatever, nursing may not be for you. But I think the stereotype that nursing is this female-driven profession, I think it's not true, and you're seeing it more and more again that male nurses are going into nursing and thriving and really enjoying it.
Like saying that doctors is male driven because nowadays I think there's more female doctors than males, at least,
Absolutely,
at least
absolutely.
50-50.
I, I,
And
I'm
what's
very I'm very proud to say that, yeah, I think healthcare has, taken the boundaries and questioned them because like you said, there's more and more female doctors in the profession, there's more and more male nurses, vice versa. So it's again, it's a teamwork. It's a team sport, healthcare is.
to your point for the young guys thinking about it, it's before the RN. Nursing school is no joke. It's a very tough bachelor's degree to obtain. So if your heart's not in it, you might find yourself wasting a lot of money and not even getting to that point because you just get overwhelmed.
And I tell people, I think there's three attributes that make you a great nurse. It's are you active? Because you have to be on your feet for 12 hours. You have to be, in decent shape. I mean, you have to be willing to, turn patients, help people get up, walk. So even the females have to be pretty, strong. And then secondly, you have to be, communicative. You have to be social. Do you like to get to know people? Do you like to
Yeah.
ask open-ended questions? Because a big part of nursing is you're communicating with your patients, but further than that, guess what? You're communicating with the doctors. You're communicating with the pharmacists, lab work, the CNAs. You're doing delegating. You're asking, physical therapy to help you with your patient. So it's a lot of, nursing, you're in the center and you're delegating a lot of the care. You're taking the orders from the physician. you're carrying out these orders, but guess what? You're not doing all of it by yourself. You're using your team as a collaborative effort. And then I think the third piece that's got to be very, very important is you have to have a sense of like a trustworthy personality. You have to have good
Yeah.
morals. Your heart has to be in it for the right reasons, or else you'll get beat down. Nursing is not for the
Oh
faint of
yeah.
heart, and you have to be in it for the right reasons.
Yeah. Yeah, that's so true. Well, you said you were into photography, right? Content creation, filmmaking. I wish I knew, well, I don't want to say that because then my life would be not where it is now, but I was a bouncer and a bartender, and I was hustling when I
Okay.
was trying, like hustling as a bartender bouncer, to try to make ends meet, make a few dollars so that I could do my filmmaking and write and direct and all that stuff. And at some point it was like I was working more than I was being creative. But
Mm,
if had I known at the time that I could have become a nurse, even like a per diem nurse, where you work in maybe 2 days a week, which as a single guy still probably brings in enough money, and then I
yeah.
could commit all the other days to my art and not have to work every night as a bartender and or as a bouncer and go multiple clubs and I wish it, it doesn't have to be your primary passion. I mean, if you can do it and do it well, but you have plenty of other time to develop yourself.
There's a girl that's become like a good friend of mine who's on social media, and her name is Lindsay Shelton, Scrubs Hack. She's very, very famous. She just hit 500,000 subscribers,
Wow.
so congrats to her. But in her bio, and she talks about this all the time, is that nursing is my plan B. And what
Yeah,
she means by that is that our lives don't have to be like, dedicated to, nursing. Obviously, it's like a sense of security, a sense of income, a
yeah,
sense of passion. She absolutely loves what she does, but she says nursing is her plan B because nursing allows her to do the things in her life that truly fulfill her and bring her joy. Going on trips with,
yeah,
her and her husband, her dogs, her content creation, photography, modeling. She has a passion for like, social programs, outreach, stuff like that. And I think it's beautiful because nursing truly does have the ability to provide you with a foundation, but use that foundation for good. Use it for,
yeah.
to fulfill your life outside of work as well.
And it feeds into all the things you just mentioned. Whether you could be a songwriter, you could be a director, what you were saying a photographer.
Yeah.
Nursing is a source of inspiration for all of that because you're getting to know people and you're gonna appreciate life and you're gonna see life from so many different perspectives. I mean, I meet patients all the time who, a guy who's a Korean veteran telling me what organization I need to contact as a vet to get certain benefits, or what school I should go to for this higher education I might be interested in, or you meet people from so many different backgrounds. Well, I want to thank you, Nico, for coming on my podcast. It's been great talking to you. I knew when I saw your profile on Instagram, because you see a lot of people that just come onto your feed. There was something about your energy that was refreshing. You seem like a smart guy, and you certainly are from talking with you. I'm jealous of where you're at right now, and spring is coming, and you're in sunny California right there,
Glenn, it's
right
a
next.
pleasure, man. I think I've been saying this for some time now, but I have like this little book here, or it's like this little like almost like a little notebook, etc. And I write down some goals and stuff like that, and like some things that I want to accomplish within nursing or within my personal
Yeah,
life. And one of my goals for 2025 is that I want to use like my, content platform to actually, meet really good people in real life. Or hey, maybe we start via Zoom and then we transition into real life. But I want to use that platform to reach more people and connect with more people. So you're a great guy. I really appreciate the time that you took, and this is just a friendship that is just now beginning.
yeah. No, like what you said, I'm really just in it for the right reasons. I'm not as much as I want followers in order to promote the channel. It's really just about getting good information to people who need it. It's the world really, it's based on your decision of what the world is. It could be a cynical place, a dark place. It could be full of lies, or you could focus on the people who are doing the best that they can.
I love that, dude.
Whether
And I'll have to
yeah,
I'll send you, or I'll think about some other people and send maybe some of their pages your way, who I think might be a good fit for you to have on and do something like this with them. And that's how you like collaborate. That's how you grow your
of course.
circle, because you interact with me, and then you interact with this person and that person, and then it gets shared, and then now you have this amazing circle of really great like-minded people. So I'll have to send you some people that I think would be a good fit for you.
Yeah, we'll have to do this again with some topics. I wanted to kind of, there's a lot of things in the news cycle out there. I'd love to get your opinion on it.
Dope,
But
man. Yeah,
again,
like, go ahead.
no, go ahead.
I was gonna say
There's a delay. There's a delay
this
with
is
the
just
timing. Yeah,
yeah, this is just the beginning. So I think this was an amazing conversation. We'll have to edit some of the great clips that we had, and then going forward, man, let's do it again. And if there's anything in the current like events, or if there's any topics that we want to address, man, let's do it. Let's hop on.
yeah, definitely. Thanks a lot, Nico.
All right, Glenn. Nice talking to with you.
Yeah, catch you later.
All right, catch you later.
Welcome back, folks. I hope you enjoyed the interview. This is just a reminder to please like, share, and subscribe, and comment. Helps the channel out against the algorithm. And really, the name of the game is getting this information out to people who need it. And I thank you all for watching. And until next time, Nurse Dad out.